Hello, everyone, and welcome to our final session of Clearwater's second annual Healthcare AI series. I'm Lisa Monroe, Director of Marketing here at Clearwater, and I'll be hosting today's event. Over the past 4 weeks, we've explored AI from multiple perspectives, from governance and regulation to cyber threats, operational risk, and responsible implementation. Throughout this series, one theme has been consistently emerged. AI's potential is extraordinary, but realizing that potential depends on trust. Today's discussion brings our series to a close by tackling perhaps the most important question of all: who defines trustworthy AI? And before we begin our presentation for today, I'd like to cover a few housekeeping items. All attendees are in listen-only mode and will remain on mute and off camera. Please submit your questions using the Q&A feature at any time during the presentation. We'll reserve time towards the end for audience questions. A copy of today's slide deck, blogs, and articles relevant to today's presentation can be found in your Resources tab on your Zoom navigation bar. Towards the end of the conversation, an attendance certificate will pop up that you can also download for attending today. This webinar is being recorded and will be made available to all registrants following today's session. And when we start the Q&A section towards the end, a brief feedback poll will prompt up. We'd really appreciate your feedback so we can continue to make these sessions valuable to you and worth your time. So, as healthcare organizations move beyond AI pilots and begin integrating AI into clinical care, administrative workflows, research, and decision-making, trust is no longer just a technology issue. It is a leadership issue, it is a governance issue, and increasingly, it is a business imperative. Today's conversation will explore trustworthy AI and what that means in practice, who can define it, how healthcare organizations can operationalize governance frameworks that support innovation rather than slow it down. We'll discuss where the industry stands today, the emerging frameworks shaping AI governance, and what healthcare leaders should be doing now to prepare for what's ahead. To guide this conversation, we're joined by three outstanding leaders whose organizations are helping shape the future of responsible AI in healthcare today. Moderating today's discussion is Baxter Lee, President of Clearwater. Baxter works with healthcare organizations across the country to strengthen cybersecurity, compliance, and enterprise risk management, helping executive leaders navigate today's rapidly evolving technology landscape. Joining him is Brenton Hill, Head of Operations and General Counsel at the Coalition of Health AI, or CHAI. Brenton has been instrumental in advancing practical AI governance for healthcare organizations and has helped lead the development of CHAI's governance playbooks in collaboration with industry leaders. His work focuses on helping organizations build responsible AI programs that are both practical and actionable. We're also honored to welcome Julie Chua, Director of the Applied Cybersecurity Division at the National Institute of Standards and Technology, or NIST. Julie leads the division responsible for many of the cybersecurity resources organizations rely on every day and the guidance that helps organizations integrate cybersecurity with enterprise risk management. So thank you all for joining us today and for sharing your expertise. And with that, I'm going to turn it over to our moderator, Baxter Lee, to begin our conversation.
Thank you, Lisa, and welcome everyone. Thank you for joining us for the final session of Clearwater's second annual Healthcare AI Summer Series. As Lisa mentioned, I'm Baxter Lee, President of Clearwater. Over the past 4 weeks, we've worked through the questions everyone in healthcare is wrestling with on AI. We started with accountability, who really owns AI across the enterprise. We took on agentic AI and the regulatory uncertainty surrounding it. We looked at what happens when the attackers bring AI of their own. And last week, we got practical about operationalizing governance and standing it up inside real organizations. Today, we close by asking a final question. As healthcare moves from experimenting with AI to deploying it at scale, who will define what trustworthy actually means, and how do organizations put that into practice? To help answer it, I've got two people who are, in a real sense, writing the rule book that the rest of us are trying to follow. Brenton Hill is Head of Operations and General Counsel at CHAI, the Coalition of Health AI, which is the group behind the new governance playbooks aiding the sector. Brendan comes at this as both a lawyer and a healthcare administrator, which is the perfect combination that we need for today. Before Chai, he was at Mayo Clinic Platform, where he helped shape its approach to emerging AI regulation and risk mitigation, and he sat on Mayo's software as a medical device review board. And Julie Chua leads Applied Cybersecurity Division at NIST. If your organization runs on CSF 2.0 or you've ever cited a NIST publication internally or at a board meeting, you've been building on what her division does, whether you realize it or not. And while NIST supports all critical infrastructure, Julie herself is very close to healthcare. She spent several years as the director of the Governance, Risk Management, and Compliance Division within HHS's Office for Information Security, where she also co-led the Cybersecurity Act of 2015, Section 405D, aligning healthcare security approaches as a public-private partnership. So it's great to have you both today and appreciate you joining, Julie and Brenton. To kick off, I'll start with you, Brenton. In a sentence or two, how would you describe where healthcare really is with AI right now? Is there more optimism or more caution?
Yeah, I think from my perspective, there is a lot of optimism, around health AI right now. There are so many organizations that are getting in the game, and I find it interesting that healthcare, at least from my perspective, is one of the industries that's kind of leading AI adoption right now. When you look at, all the other industries and all the other sectors out there, healthcare is usually the kind of lagging, group that comes in and adopts technology last. I think for once we're seeing that healthcare is actually leading in some of the adoption of this, right? Maybe not on everything, but I think there's so much optimism, but it's bundled with an abundance of caution, right? We're starting to see some new legal cases come about. We're starting to see other things coming about. So I think there's a lot of optimism, but also with, proceeding with caution as well.
Yep, definitely see that. Thank you, Brenton. Julie, what's one thing you're hearing from health systems this year that you weren't hearing a year ago?
So I think piggybacking on what Brenton has just said, I think there is a lot of leaning in terms of being on top of the governance piece, which I think this series has been talking about, and this will certainly come in our conversation today. And I do think that is one where it came about from how the health sector has really embraced emerging technology as it came in. And what I mean by that is in the past 20 years or so, a little bit of lagging with cybersecurity and how to deal with that. But then 10 years ago, all of a sudden it clicked, but it came from breaches and big incidents, etc. I think this time, a lot of the lessons learned, the sector is seeing and applying. So they're more leaning forward. How do we define our trustworthiness within our organizations? How do we look at that metric or that measure for what we think as an organization should be trustworthy or should be ethical or should be all the other AI RMF characteristics for what trustworthy AI is? So in another broader sense, is I do want to paint the picture for us and the audience regarding what NIST looks at in terms of all critical infrastructure. And it's an understatement. I think we're going to hear it is AI is advancing so rapidly. And I think that's where the anxiety is coming from. And I do think, though, that's where the leaning in is coming from, too. And one last thing before I hand it over again to Baxter is that there is enormous potential. What NIST is looking at, though, is from a cybersecurity perspective, how is AI changing the guidance, the guidelines, frameworks, standards that we have today in terms of cybersecurity and privacy? And the other piece of it is, and I'll get more into it later, is NIST is standards. And I love that Lisa also started us with trust. So we cultivate trust by having standards so that interoperability kind of comes into play, as well as knowing what is it that we are trying to measure and having the tools and the tests and evaluations to do that. So that was a lot, but
Yeah, no, I think
um,
that's great. And what I'm
yeah.
hearing, and I think what we're all experiencing, is there's a lot of excitement for AI. The promises are significant, and could be, transformative for the industry. But there's also a healthy amount of caution, and maybe learning from recent, cyber breaches and incidents over the last several years. How do we go into this in a way that, we can protect the industry, protect the patients, their data while also realizing the benefits? And I think that's the ultimate goal that we all want to achieve, which is a great segue into the frameworks that are taking shape here. Brenton, I'll start with you and the work you're doing at Chai. You guys just released, your governance playbooks, with the Joint Commission behind the effort as well. And for a compliance or security leader hearing about these for the first time or trying to get up to speed, what are these playbooks, and what problem do they solve for these healthcare organizations?
Yeah, so the reason and really the impetus behind this was, we looked at our members. We have a number of different health system members that were coming to us saying, hey, we're past the principle stage of, we understand what principles we should be following theoretically. Can you now get us into some really concrete steps and that are grounded in the AI life cycle that we can start to take as an industry and do it? So that was really the impetus behind it, was moving from principle to more controls-based methodologies and helping organizations understand, okay, across the entirety of the life cycle, here's what that means. And so, for instance, how we've kind of gone about this is we have around 8 different playbooks we've developed, all stemming from, how do you develop an AI policy? What should be your organizational structure? What organizational resources come into play like that? AI inventory, computing, workforce competency. And then what are your organizational processes on the day-to-day, right? So in terms of how you're leveraging that from the responsible AI lifecycle. How do you do risk and impact assessments? What's your responsible data use? How are you managing third-party vendors? And then how are you educating, training, and soliciting feedback from your staff? And so the goals of these is to really position organizations to think critically. It's not to give you all the answers, right? Because if you look at governance, it really needs to be tailored to your individual organization's risk positions. Obviously, the population you serve, what type of infrastructure you've built out. But the goal is to give you concrete controls that you can say, okay, with our given infrastructure, with our given risk positions, with our given, staff, here's how we can put together an effective end-to-end governance program that will help us to, continue to scale AI, right? And the goal of this isn't to, be perfect at it, right? No one's going to be perfect. This is very much a maturity-based framework, and that, hey, if you start with an AI policy and all of a sudden you're building out your AI inventory and you know what's happening and staff know here's what the acceptable and not unacceptable uses are, and we're tracking and we're making sure we're limiting shadow AI. That is a great way to get started on day one to say we're going to tackle some very, very low hanging fruit and aid it like that. So again, it's supposed to be end to end, but really getting organizations to think critically about where they start and then where they can scale as they continue to get more mature in the space. So
Yeah, I think the playbooks are great, and they provide great guidelines for organizations to so that everyone's not trying to reinvent the wheel on how to tackle these challenges. I guess from your perspective, what are some of the harder parts of the playbooks for organizations to actually stand up and implement?
yeah, I think right now, I mean, the thing that we're hearing most is AI monitoring, right? How do we monitor AI? And I think it's really hard because one, there's no, there's no clear defined metrics for what we should monitor. And I think that's just a result of the technology and the pace that it's moving. Completely agree with you, Julie, that the technology is moving so fast that if we were to go spend, a year working on metrics for any given use case, that use case, not that it would be obsolete, but you would have 3 other use cases that are far more advanced that have different considerations, right? So I think that's a big part of the issue, right? The science quite hasn't caught up with where people are adopting, what people are doing, right? There's still very much a black box sense to AI, even though we have more in-depth understanding about it. And I think one of the more emerging issues that organizations are starting to struggle with is the training and education component, right? How do one, how do you train a staff member to use AI responsibly? What are their roles and responsibilities in that? And then also, how do you incentivize use and get saturation,
Yep.
right? So much of this is I think there's a number of different camps that people fall in. There's a lot of people who are, hey, I'm never going to use AI. I don't believe it. There's people that are, on the other end of the spectrum. Hey, we want to use it for everything, and I basically want to replace myself. And then there's the, spectrum in between. And so, how do you take different knowledge bases, different, stakeholder groups, different employee types, and train them to use it responsibly? And then, how do you have a plan to actually scale use of technology that actually brings a return on investment? So hard, so interesting, something that not many organizations, if any, have been able to tackle yet. But I think there's going to be a lot of thought that's put into that in the coming years as organizations try to figure out, how do we make the best use of it. So
Yeah, I think we're all learning very quickly, right, as this is evolving, and we're learning how our organizations can adapt to these new technologies and how they fit in our organization, and then the structure of governance around that. A lot of the recent work it really sits on the front end with AI intake and screening questionnaires, contracting, things of that nature. Why start there, and what does good intake look like, and on the front end of the AI adoption curve?
yeah, I mean, I typically deploy, I have an ops background, so hospital administration. And I think when it comes to how to prioritize and how to problem solve, you always have to start with, do we have an identifiable problem and can we solve that? Do we have the right resources, et cetera, et cetera. And so to me, I think for organizations that are like, where do we start? It's start with the low-hanging fruit, and that's what we're trying to do. And we've heard that even in these initial phases, right, where you're risk triaging, where you're identifying the risk, and then you're trying to put that into contracting, there still is a large number of bottlenecks that are happening there. We've heard, anecdotal evidence that, hey, there's over, between 200 and 500 solutions in the queue at a large number of these systems, right, that are bringing in a significant amount. And so we focus there because I think it's something that is long overdue, some guidance and best practices around just how do you evaluate and assess a vendor, whether that's an existing vendor, whether that's an internal developer, or whether that's a new vendor. There's different considerations, but principles are relatively the same, right? And from our perspective, I think a good vendor assessment really covers a number of different things. We did a study with over 800 questions from 15 different institutions, and intake should, I shouldn't say should, but intake questionnaires from these different institutions cover the following. So, clinical safety and effectiveness, right? So if it's going to be clinically facing, does it have safety and effectiveness, right? That's the main worry, and I think, consideration there. Has the vendor been assessed for fairness and non-discrimination, right? Is it going to work for different populations, different stakeholder types? A good example of this is, hey, is my ambient scribe going to work for peds as well as it does for adults, right? You have to consider, all the different, stakeholders and intended use across that spectrum. Does the vendor have legal and regulatory compliance? Is there security and access controls? How well is it going to integrate into the workflow? Can we configure it to work in the workflow, right? Is there data integrity, and can they show lineage for the data? What is the governance and oversight of the vendor? Governance and oversight of the vendor, right? So, us as the procuring organization, we have governance. Does the vendor have effective governance? Because they're using a lot of the frontier models and a lot of this the same as well. And a lot of the institutions want to ensure that, hey, if we're going to be using AI responsibly, you better well make sure that you use it as well. And then, of course, the model validation and monitoring, what considerations do we need there? Transparency, traceability, and then, lastly, impact measurement and ROI. And so we found that, an intake questionnaire could range from 15 different questions all the way to a couple hundred, just depending on the sophistication and the desires of the institution. we've tried to bring that into about 60 questions that we're going to be releasing in the coming months. And so we're very excited about that. But yeah, I would say as long, if it covers those main areas, that's what most organizations that we're seeing today kind of focus on.
Yeah, like any big, and any technological initiative, how you start, right, is going to determine your success, and getting that foundation right on the front end is critically important. So really appreciate those thoughts. Julie, let me bring it back to you on the NIST side. For folks who know NIST mainly as frameworks, how would you describe NIST's role in supporting critical infrastructure, including healthcare?
Sure, and I do appreciate, Brenton, all the things that you mentioned already. And I'm gonna put a fine point into it because I want one of the key takeaways today is governance and enterprise risk management. And all the things that you've said, it touches on all those, and having a mindset that we all have a role, whatever emerging technology we implement, we deploy. It has to be grounded on the business need, the mission, and for healthcare, it's not lost on me, and it's still kind of inculcated in my mind where it is patient safety, it is patient outcomes. So if folks ground themselves on that, no matter how scary, I'm going to say it because it is a word that is associated with AI, no matter how scary it is, we know why we are implementing AI, or we know why, as a board or as a clinician, we are intending to use AI in some capacity. But going into the framework people question, I do want to get the audience acclimated to the fact that NIST does support healthcare and public health. And I know that for a fact because I was a part of that ecosystem, just a few years ago, actually, where we advise and we consult critical infrastructure sectors to tackle not just sector specific issues, but what we think are very fundamental standards based and standards, maybe solution based things that we need to look into in our research and our technologies, and also building some of the test and evaluation tools that I kind of mentioned in the beginning. But to ground ourselves on how we support critical infrastructure, I'm going to go back to cultivating trust. And how we do that, it's fast. Not, I'm going to say it where it's not literally fast, but fast as an acronym. So we do fundamental and applied research. We also do standards development, and we work with standards development organizations, industry, academia, to make sure that we are taking a look at where and what technologies need standards to be universal, to be interoperable, to address the most pressing, whether it's a vulnerability or a configuration, like Brenton said, of that technology before it gets deployed or before it is used by industry and society as a whole. And the last part of FAST is T. So that's tech transfer or transfer to practice. So one good example is within our National Cybersecurity Center of Excellence, the NCCOE, we put forth all the NIST standards, frameworks, international standards and frameworks. We do test beds. We demonstrate that these are practical implementations of those standards, frameworks, guidelines, etc. We are also able to get feedback where is it really applicable? Is it really implementable? And where does NIST need to adjust? So those are the ways that we actually help all of us, including myself, I guess, part of society. And I think the last thing I'm going to say for this question is we really do research on CETs to understand specifically in my division, the security and privacy capabilities, vulnerabilities, configurations, and where standards, frameworks, etc., are existing or need to be adjusted or new ones need to be developed. And with that, basically, we are able to, especially with AI, as another part of our lab outside of the cybersecurity division, we are able to take a look at also the measurement tools, the evaluation tools, and the testing tools. To Brenton's point, what are we measuring? And if we have already decided on what to measure, then hopefully at that point, NIST has a tool or an evaluation methodology to do that.
Yeah. I mean, it's incredibly important work, and I think we all recognize the value that NIST brings, particularly with the wide adoption of the NIST standards, and the NIST CSF 2.0 is a very important framework that many organizations are using to measure themselves and their programs and maturity. Recently, as the evolution of NIST 2.0, you guys added a governance function. You mentioned governance in your comments earlier. Can you speak to why that matters, and how does that translate into the AI conversation and other emerging technologies?
Sure. If anything, the key takeaway from my remarks today is governance and enterprise risk management going hand in hand. That is fundamental and imperative with any emerging technology that an organization, excuse me, is choosing to implement, deploy, integrate within their ecosystem. I say that because thankfully Brenton already kind of listed out what an intake questionnaire form process would look like. And if you notice, everything boils down to people, process, and the technology that you're looking to do. And if you put governance on top of that, that's where you get into this is my mission space. In healthcare, protecting patients, patient safety, patient outcomes. And when that is grounded, when your technology implementation is grounded on those, the hard questions about who is responsible for trustworthy AI? Where does ownership of data when you use it in AI lie? Where does ownership of the risk for AI reside? Those tough questions actually get answered because your executive leadership, whether it's a board, a risk management council, a steering committee, any governance structure that a healthcare organization has, they more than likely already have a risk appetite statement, a risk tolerance statement. They likely already have what kind of measures they are looking into when they are looking at enterprise risks writ large. I'm going to be bold and say they likely have a risk profile, and AI, cybersecurity, privacy, legal, compliance is all in there, and they are taking a look at that as interrelated and not just this is my AI risk management strategy, this is my cloud, this is my this, et cetera, et cetera. And that's why, at least on the cybersecurity side, we at NIST decided that govern and governance is important because one, cybersecurity is a very concrete domain, and you can really set forth these are the outcomes when you do governance in cybersecurity. And everything else in terms of information and communications technologies or critical and emerging technologies, it's easy to have the same or similar process when you go through your risk management strategy. So lots said there, but I hope the key takeaway of governance is important is coming through.
Couldn't echo enough the importance of governance and enterprise risk management. And speaking of risk management frameworks, this also gave us the AI risk management framework recently. What does it ask of organizations and to think about traditional cyber risk and how that compares and fits into this new emerging technology?
So reiterating what I just said, I think anything that has to do with an organization's information and communications technology, and I differentiate that, and this differentiates that from critical and emerging tech because you can have quantum in there, you can have biotech, which is another priority of NIST, semiconductors, and all of that. I do think if you are a cybersecurity professional, you can look at the AI risk management framework and find how some of the controls or some of the outcomes of the CSF can be applied to the AI RMF. But if you look at just the AI RMF, there is a set of trustworthy characteristics, safe, secure, and resilient, fair with harmful bias managed. All those are AI specific risks that can be addressed, managed with your governance structure and integrated with any governance structure that an organization has. And I wanted to make sure that I mentioned that the AI RMF one has a playbook also that NIST released